What happened? Why are you calling?
Because she's having a heart attack, she's dying, she's not breathing, and she's not moving.
Ma'am, she's not breathing?
She can't breathe.
Okay, is she breathing?
No, she's not.
She's not breathing.
No, she's throwing all those black stuff around her mouth, and we trying to do CPR on her.
Okay, so she's not breathing at all.
She's not responding.
Many of you have heard about Kanye West, one of the most famous and influential artists of our time. But behind the man who shaped the sound of an entire generation, there was someone who shaped him, his mother, Donda West. She wasn't just Kanye's biggest supporter. She was an accomplished woman in her own right, a respected academic who dedicated her life to education and, eventually, to helping her son navigate the complexities of fame. But there's a side to Donda West's story that many don't know, a tragic turn of events that unfolded after a decision to undergo cosmetic surgery. What should have been a routine series of procedures took a devastating twist. The doctor who performed her surgeries, Dr. Jan Adams, had a history that raised more than a few eyebrows, and soon after, the medical mishap that followed would shake the world. What went wrong during those surgeries? Could it have been avoided? And how did a trusted professional, with a past full of red flags, end up at the center of this heartbreaking event? As we dive into the details, these questions will unravel, revealing a tragedy that left not only Kanye West, but an entire nation in mourning. Now, before we continue, I'd like to ask you a small favor. Our channel is still new, and every single subscriber helps us grow. Your support motivates us to produce even more in-depth, high-quality content like this. So if you're enjoying these deep dives into medical mishaps and want to stay updated on future videos, please consider subscribing. It's a simple action that would mean the world to us and ensures you never miss out on any new cases. Now, without further ado, let's get back to the case. Donda West, born on July 12, 1949, was more than just Kanye West's mother. She was a highly accomplished woman in her own right. An English professor and former chair of the English department at Chicago State University, Donda was deeply involved in education and nurturing young minds. She earned a PhD in education and became a prominent figure not only in her academic field, but also as an advocate for her son's musical career. As Kanye's fame skyrocketed in the early 2000s, Donda stepped into the role of his manager, helping him navigate the complexities of the music industry. They shared a close and loving bond, with Donda serving as both a mentor and a steady figure in Kanye's life. She even wrote a book titled Raising Kanye, where she shared insights into their relationship and Kanye's upbringing, offering a glimpse of her values and philosophy as a parent. As she approached her late 50s, Donda decided it was time to make a change. Like many women navigating the pressures of aging, especially those connected to the spotlight, she sought cosmetic surgery to maintain the youthful energy she felt inside. After careful thought, she opted for a combination of procedures: liposuction, a tummy tuck, and breast reduction. It wasn't just about appearance for Donda, it was a personal choice, a way to embrace her own confidence and well-being. Despite her medical history, she trusted the process, hoping it would offer her a renewed sense of self. Unfortunately, it was a choice that would soon take a tragic turn. The surgeon, Dr. Jan Adams, who would eventually perform Donda West's cosmetic procedures, had built a reputation that, at first glance, appeared impressive.
Hello, I'm Dr. Jan Adams, a plastic and reconstructive surgeon here in Beverly Hills, California. Today, you and I are going to talk about skincare, in particular, skincare for women of color.
Born in Middletown, Ohio, Adams followed a path that many would consider prestigious. He earned his medical degree from Ohio State University and specialized in plastic and reconstructive surgery. Over the years, Adams became a familiar face on television, appearing as an expert on various talk shows, where he shared advice on cosmetic enhancements. He even authored several books about plastic surgery, presenting himself as an authority in the field. To the public, Dr. Adams was a trusted figure, someone people turn to for life-changing transformations. However, beneath the surface, Dr. Adams' career was far more complicated. By 2007, just before Donda West approached him for her surgeries, Adams had already been entangled in a series of legal issues that raised significant concerns about his professional conduct. His career was marred by multiple malpractice lawsuits, two of which resulted in major settlements, one for $250,000 and another for $217,000. These lawsuits stemmed from allegations of improper medical practices and post-surgical complications from other patients. For anyone looking beyond his public persona, these legal troubles were glaring red flags, suggesting that his surgical outcomes were not always as smooth as he portrayed on TV. Compounding these professional issues was a troubling history with alcohol. Dr. Adams had faced multiple DUI arrests, each time further calling into question his ability to safely and responsibly practice medicine. His repeated legal battles with the Medical Board of California were a clear indicator that his practice was far from flawless. Adams had been in and out of disciplinary hearings, facing scrutiny over whether his personal struggles with alcohol were affecting his work as a surgeon. Despite this string of issues, Dr. Adams continued to operate his clinic, and in November of 2007, it was under these circumstances that he took on Donda West as his patient. With a history of risky behavior and questionable surgical practices, the question remained, was Adams truly the right person to perform Donda's complicated procedures? For Donda, like so many others, the trust she placed in his well-polished public image would prove to be tragically misplaced. As on the morning of November 9, 2007, Donda West arrived at the medical facility where her elective cosmetic surgeries were scheduled to take place. The plan for the day was straightforward. Dr. Jan Adams would perform a series of procedures aimed at achieving a more youthful appearance for Donda, who, at 58, felt societal pressures as the mother of a high-profile celebrity. She had chosen to undergo 3 significant surgeries in one session: liposuction, a tummy tuck, also known as an abdominoplasty, and a breast reduction. These surgeries, though common, are complex, especially when performed together. Once Donda was prepped and under general anesthesia, the surgical team began the first procedure: liposuction. Liposuction involves inserting a thin, hollow tube called a cannula through small incisions in the skin. The cannula is moved back and forth to break up and remove excess fat deposits. This technique was primarily focused on areas around Donda's abdomen and thighs. Though liposuction might sound simple, it carries risks, especially for patients with underlying health conditions like coronary artery disease, which Donda had. Removing large volumes of fat can lead to fluid imbalances, which may put a strain on the heart and other organs. Once the liposuction was complete, Dr. Adams proceeded with the tummy tuck, or abdominoplasty. This procedure is far more invasive than liposuction, requiring a large incision along the lower abdomen. In Donda's case, the surgeon removed excess skin and fat while tightening the underlying muscles to create a firmer, flatter abdomen. Afterward, the skin was pulled down and sutured in place, leaving a scar hidden beneath the bikini line. Given the extent of this surgery, Donda's body would have been under significant stress, with the potential for blood clots, infections, and other complications. Following the abdominoplasty, the final procedure was a breast reduction. Dr. Adams made incisions around the areola and down to the lower breast crease, removing excess fat, tissue, and skin to reduce the size of her breasts. While breast reduction surgeries are generally considered safe, they still involve the risk of infection, poor wound healing, or issues related to anesthesia, particularly for older patients with existing health concerns. After several hours in the operating room, Donda's surgeries were complete. According to Dr. Adams, everything had gone smoothly, but the real danger often arises after the procedures are done. Post-operative care is essential in cases like Donda's, where the body has undergone extensive stress. Despite this, she was discharged on the same day, a decision that has since become one of the most scrutinized aspects of her case. Patients who undergo such multiple and invasive procedures are typically kept under medical observation for at least 24 hours to monitor for any early complications, such as blood clots, respiratory distress, or fluid imbalances. However, Donda was sent home to recover. At home, she was reportedly in the care of her nephew, Stefan Scoggins, a nurse with some medical experience. However, Scoggins lacked specialized training and was not fully equipped to handle the complexities of post-operative care, especially for someone who had undergone such extensive surgery. Donda had undergone not just one, but 3 major cosmetic procedures in a single session, each of which carried its own set of risks. The recovery process was supposed to involve close monitoring of vital signs, heart rate, blood pressure, and oxygen levels, to ensure her body was healing correctly and not overburdened by the stress of the surgeries. However, in the hours following her discharge, Donda started showing signs that something was wrong. Fatigue, difficulty breathing, and chest discomfort are common after surgery, but when these symptoms worsen, it can signal more serious issues, such as blood clots or respiratory distress. Donda began experiencing increased difficulty breathing, which should have been seen as a red flag, especially considering her history of coronary artery disease. Coronary artery disease weakens the blood flow to the heart, and any added stress from surgery can push the body toward complications like heart failure or pulmonary embolism, where a blood clot travels to the lungs, blocking essential blood flow. By the next morning, November 10, 2007, Donda's condition had significantly deteriorated. She was found unresponsive, struggling for breath, a state known as respiratory distress. This condition occurs when the lungs are unable to provide enough oxygen to the blood, causing the body's organs to start shutting down. The lack of proper post-operative monitoring made it impossible to detect and address these warning signs before they turned life-threatening. Upon discovering her in this condition, her family quickly called emergency services. Paramedics arrived, and they attempted to stabilize her as she was rushed to the nearest hospital. However, by the time they arrived, it was too late. Donda was pronounced dead on November 10th, just one day after her surgeries. The immediate cause of death wasn't entirely clear in the chaotic moments following her passing, but medical experts quickly suspected that a combination of factors had contributed. Pre-existing coronary artery disease played a significant role, as it had already placed a heavy burden on her heart. When combined with the stress of the surgeries, Donda's body struggled to recover, and it appears her heart simply couldn't handle the strain. Post-operative factors like fluid buildup, which can lead to swelling and further complicate breathing, may have worsened her condition. Following her death, an autopsy was performed to clarify the exact cause. The report found that while the surgeries themselves did not directly cause her death, they had placed enormous stress on her body. Her coronary artery disease, which had likely been stable before the surgery, was exacerbated by the procedures and the lack of intensive post-operative care. Multiple factors were noted, including possible pulmonary embolism or heart failure, both common risks after major surgeries, especially when pre-existing health conditions are involved. One of the most significant points raised by the autopsy was whether more intensive post-surgical care could have prevented her death. Had Donda been kept under medical supervision for 24 to 48 hours, her respiratory distress might have been caught early enough to intervene. For someone with coronary artery disease, post-operative monitoring often includes continuous oxygen saturation checks, blood pressure monitoring, and regular heart assessments, all of which could have highlighted early warning signs of distress. The autopsy findings didn't place direct blame on Dr. Jan Adams, but the implications were clear. Donda's death was likely the result of a combination of factors that could have been mitigated with more aggressive post-operative care. The decision to discharge her so soon, despite her age and medical history, raised significant concerns in both the medical community and the media. For many, it wasn't just a question of whether the surgeries were performed correctly, but whether the right decisions were made about her care afterward. Dr. Jan Adams maintained his position that the surgeries had gone well and argued that Donda's death was due to her pre-existing health conditions, not his surgical actions or post-op decisions. However, critics, including many in the medical field, argued that given her coronary artery disease, she should have never been discharged the same day. The standard of care for someone with her medical history would have been closer post-op supervision, potentially in an ICU or step-down unit, where complications like blood clots or fluid buildup could be managed in real time. Kanye West, deeply affected by his mother's death, questioned whether more could have been done. The public began to wonder why a high-profile surgeon like Dr. Adams, with his history of malpractice lawsuits and legal troubles, had been allowed to operate without greater scrutiny. The controversy surrounding her discharge and the broader implications about cosmetic surgery safety fueled debates on whether the medical system had adequately protected patients like Donda. Dr. Adams, in the midst of growing criticism, appeared on national television to defend his reputation. During an interview on The Larry King Show, he was asked pointed questions about his responsibility for Donda's death. Yet, instead of addressing the concerns, Adams abruptly walked off the set, leaving more questions than answers. This act only added fuel to the fire, with the public questioning whether he was hiding something or simply unable to confront the hard truth of what had happened. As the story unfolded, it sparked broader discussions about the ethics of cosmetic surgery, particularly for patients with existing medical conditions. Could Donda's death have been avoided with better oversight? Should surgeons take greater responsibility in advising patients like her about the full scope of risks, especially when elective surgeries are involved? The questions lingered long after her passing, and her case became a cautionary tale for many considering cosmetic procedures. The aftermath of Donda West's death was rife with legal and ethical concerns, particularly surrounding Dr. Jan Adams and the broader question of responsibility in elective surgeries. One of the most contentious issues was whether Adams, given his past malpractice suits and legal troubles, should have been allowed to continue practicing at all. By the time he operated on Donda, Adams had already settled 2 malpractice suits and faced multiple DUI charges. These factors led to serious questions about the regulatory oversight of surgeons, especially those who specialize in high-demand cosmetic procedures. Legally, no formal charges were filed against Dr. Adams in relation to Donda West's death. However, the surgeon's reputation was severely damaged, and public outcry prompted closer scrutiny of his professional record. Critics argued that the medical system had failed by allowing a surgeon with a questionable background to continue operating, and this case shone a spotlight on the lack of transparency in how medical professionals with legal and ethical issues are allowed to practice. Ethically, Donda West's death raised questions about the responsibility of medical professionals to adequately inform patients of the risks associated with surgery, especially when those patients have pre-existing health conditions. Donda had coronary artery disease, a condition that should have warranted extreme caution when considering elective surgery. Some medical professionals questioned whether she had been properly informed of the risks, or if there had been enough emphasis on post-surgical care and monitoring, particularly given her age and health status. Additionally, there was the ethical dilemma regarding her discharge from the medical facility. Was it appropriate to send her home so soon after such extensive surgery? And was it responsible to allow a family member with no specific post-surgical expertise to oversee her recovery? News of Donda West's sudden death sent shockwaves across the world. As the mother of Kanye West, one of the most influential figures in music, Her passing wasn't just a personal loss, but a public event that garnered immediate media attention. Fans were left stunned, not only grieving alongside Kanye, but also speculating about how such a tragedy would impact the artist's career. Kanye and his mother had shared an exceptionally close bond, one that was reflected in his music, interviews, and public appearances. Her death left a profound emotional scar, one that Kanye would struggle to cope with for years to come. The pain he experienced was deeply personal, yet it played out under the relentless gaze of the media. As the details of Donda's passing slowly emerged, the controversy surrounding her death only grew. It wasn't long before the conversation shifted from a personal tragedy to a broader societal issue: the safety of elective cosmetic surgeries. Donda's death became a flashpoint in this debate, raising urgent questions about the medical industry and its regulation of surgeons. As the public learned more about Dr. Jan Adams and his history of malpractice lawsuits and legal troubles, the spotlight turned to the larger system that allowed doctors like him to continue practicing despite their troubling pasts. How could a surgeon with such a questionable track record have been allowed to operate on someone like Donda West? This wasn't just a question of personal accountability. It became an indictment of the medical system itself. Donda's death was framed by many as a preventable tragedy, one that could have been avoided if stricter oversight had been in place. The media and public alike were quick to point fingers, not just at Dr. Adams, but at a system they felt had failed her. Conversations about the ethics and safety of cosmetic surgery grew louder, and the issue of patient safety, particularly for elective procedures, was thrust into the national spotlight. The entertainment industry also reacted strongly. While many offered condolences to Kanye, empathizing with the personal devastation of losing his mother, others took a more critical view, highlighting the pressures that lead individuals, especially women in the public eye, to undergo cosmetic surgeries. Donda's death became part of a broader discussion about societal beauty standards, particularly the pressures on older women to appear youthful. Her case highlighted the dangerous intersection of celebrity culture, beauty ideals, and medical ethics. Kanye West, always open about his emotions, would go on to publicly discuss the overwhelming grief he felt after his mother's death. This loss profoundly influenced his music and public persona. His 10th studio album, Donda, was named in her honor, a deeply personal tribute that illustrated the indelible mark she had left on his life. From songs dedicated to her memory to moments of vulnerability in interviews, Kanye's grief became a key aspect of his artistic expression. His public struggles with loss added another layer of complexity to an already tragic story, one where his personal pain became intertwined with public scrutiny. But Donda's legacy didn't end there. Her death spurred legislative action aimed at preventing similar tragedies. In 2009, California passed the Donda West Law, a direct response to the circumstances surrounding her passing. This law mandates that patients undergo a thorough physical examination and receive medical clearance before undergoing elective cosmetic surgery. It was a legal safeguard, designed to ensure that patients with underlying health conditions, like Donda, were fully assessed before embarking on potentially risky procedures. Though this law couldn't bring Donda back, it served as a tangible reminder of the importance of patient safety and the need for better regulation in the cosmetic surgery industry. In the end, Donda West's death became more than just a personal loss for her son. It was a catalyst for change, sparking conversations about medical ethics, the pressures of beauty standards, and the need for greater accountability in the medical profession. Her life and death continue to resonate, not only through Kanye's music, but in the ongoing conversations about how to protect patients from the tragic consequences of a broken system. Yet still, her passing raised critical questions about the intersection of medicine, ethics, and personal choice. Was Dr. Jan Adams truly at fault, or was this an unfortunate mishap caused by factors beyond anyone's control? Could more have been done to prevent her death? Or was it simply a tragic consequence of the risks that come with surgery? We'd love to hear your thoughts. Do you believe this was a case of medical malpractice or a complex situation where the lines blur? Let us know in the comments below. And if you found this story engaging, don't forget to hit the like button, share this video with others, and subscribe for more content like this. Make sure to click the bell icon so you don't miss out on future documentaries. And if you haven't watched our previous videos, they'll be popping up on your screen now. Definitely check them out. Thanks for watching,